Thanks for joining me today. The topic for today's podcast is going to be dehydration. I want to discuss the dangers of dehydration, how you prevent dehydration, and how, as a family member, you can look for the potentials for it coming on, because really this is the kind of thing you want to head off at the pass. Oftentimes, with dehydration, you won't learn about it until the person is in the emergency room or the ICU. It's very common in nursing homes, usually due to understaffing, but I want to discuss all that with you today. So most people have at least a passing familiarity with or vague understanding of dehydration. It's just you don't have enough water in your system. Usually when we think of dehydration, we're thinking about kids doing sports, or I'm a distance runner. When you're out running in the summertime, you have to watch the temperature, and it can be a very serious condition if you don't address it consistently. Now, in nursing homes, I've had countless cases with dehydration. This is a major problem with people with cognitive impairment, because oftentimes these folks, while they can experience pain, they do suffer, they experience discomfort, they often don't know the cause of it, right? And so one of the problems is they forget to drink. It's just as simple as that. They just forget to drink. And this is very common. If you are working in long-term care, if you are within the nursing department, you know this, that when you have people that suffer from either Alzheimer's or dementia, they often forget to drink. And while they're feeling the effects of it that are unpleasant, they don't necessarily understand what the root cause of that is or the etiology, right? So in this respect, it can be very dangerous, because while their body's telling them, listen, you have to address this, they don't understand what that's all about, and they will often forget to drink. Now, I see this frequently in understaffed facilities, because the folks that are most charged, or that are primarily charged with addressing both eating or feeding and being sure that the residents are adequately hydrated, are the CNAs. Oftentimes in these facilities, the CNAs are too busy because they have way too many residents to care for. People who have cognitive impairment are high acuity. You really have to keep an eye on them. And so when you don't have enough aides to do the simple tasks like activities of daily living, like eating and drinking, it falls off the map. Additionally, the most time-intensive task for any certified nurse aide is feeding. Oftentimes, residents need someone to not only get it ready for them, but also to feed them physically. And you may have had this experience with your own family member. This is the most time-intensive task an aide is going to do. So when they don't have enough of them, this is the first one that suffers, right? I've had multiple cases where aides are just keep shoveling food into people's mouths. And the problem is that the washing it down part just gets completely looked over, right? Now, you can get water from your food, but primarily you're going to get it drinking. Another challenge you have with residents in long-term care is oftentimes they may have a condition called dysphagia. That is, they have a problem swallowing. And so the way you address this sometimes is a dietitian will make a recommendation for a swallow study to see if they're going to have issues with drinking thin liquids, they would call it, right? Like regular water, things of that nature. Some people tend to what they call aspirate. For all the genius of our body's engineering, the idea that the same tube brings food, water, and air, I don't know. I think the engineer might not have been paying attention that day. It's not the best idea, but that's how we're designed. So when you have difficulty swallowing, the fluids can go into the lungs, right? And that's a serious problem that leads to pneumonia. So what they'll do is they'll thicken the liquids. They put a powder in there, they stir it in, it thickens the liquid, and it makes it easier to drink. But when you have thickened liquids, you're more susceptible, in my experience, to dehydration, because getting the correct volume of liquid down can be difficult or take more time. And if you don't have enough staff, then that's the problem. So what is the problem with dehydration? Well, number one, it can lead to electrolyte balances, right? These are things like sodium and potassium. And if these things are out of whack, they can really cause serious problems in your body, including your heart and your organs. And so very important to be sure you have a proper electrolyte balance. Additionally, you can get dehydrated to the point where your blood pressure starts to drop, and it can drop to a place where you go into shock, and that can be lethal. So that's another significant consequence of dehydration. Additionally, I've had many, many cases where people go into kidney failure. Their kidneys just shut down because they're so dehydrated. And additionally, when you're dehydrated, in my experience, it can also promote infections, things like urinary tract infections, things of that nature. Basically, just the concentration of anything is more of a problem. So in particular, if those infections move into your blood, you go right into septic shock, which also can be lethal. So the simple process of just getting enough fluid is critical and key, and very, very easy to address. Okay, so, well, how do you know, right? How do you know? Well, the most simple process is what they call I and O's. That is the letter I, the word and the letter O, intake and output. Staff can monitor how much a person is taking in and how much is going out the door, right? Now, I and O's are not complicated and they're not tricky and it's not super specialized. So when you have a resident that's at risk for dehydration, they're going to know this, all right? There's a document when they come in called a minimum data set, and that may be checked off on there, which means it needs a care plan. So one of the typical interventions is I and O's. Now, if you are visiting your resident frequently enough, you can do this yourself, right? I'm going to talk to you about how some ways you can do this, at least on the intake side, but monitoring I's and O's. I know when my father, he passed away from cancer. He was real sick. He didn't want to eat food, so basically we were just giving him Ensure over and over and over. And I knew how many bottles a day he had, because oftentimes he wouldn't think to drink, and he was cognitively intact. So this really can happen to anyone, but in particular when you have these folks that are suffering from cognitive impairment, it can be a bigger concern. Okay, so I and O's are a big way of doing it, but and so if you have something like Ensure, you can just track the bottles. He's had 3 bottles a day, 4 bottles a day, 2 bottles for breakfast, whatever it happens to be. Okay. Now, oftentimes what I'll find in nursing homes is they'll have a water cup for a resident. Sometimes they'll scroll the date on it. It's usually styrofoam. It usually has a lid with a straw. And ultimately, they're usually pretty big, but I see these cups and it doesn't tell me anything other than that there is a cup of water next to the bed. So one thing I suggest to people, and I will tell you this, a lot of people don't like really cold water, especially in the fall, winter, and spring. So, just putting a cup full of ice water in there sometimes is not. They don't want to drink it. They want to drink water that's that's room temperature. So here's what you can do if you're seeing this. I mean, look, you can look at the cup and see if it's been drank from, or ask the staff when's the last time you filled it with fresh water. But you can also get cups or water bottles that have that are graduated. That is, there's an amount you can see on the side. This is typical today. It took 10,000 years of civilization to learn that water is important. So I've seen my staff have these water bottles. They actually have how many milliliters on the side. So you can see how much is in there and how much did they drink. And then you'll know, right? Then there's a very accurate reading for intake, right? Which is really what you want to be watching. Now, the output can be a little trickier. If you have a resident that is incontinent and is in an adult diaper, that can be a problem. Additionally, a very common illness in nursing homes is C. diff. That's C period, DIFF period. That's a Latin abbreviation for a bacteria that we have in our gut, which would, if you go on antibiotics, the diff, I believe, stands for difficile. It's very hard to kill this bacteria. Now, it's normally fine in your gut when you got all kinds of stuff going on down there and other bacteria it's competing against. But when you take antibiotics and it kills all the other bacteria, the C. diff is the only game in town. And so what happens is the C. diff can do whatever it wants, so it starts to proliferate. And the problem with C. diff is that particular bacteria, when it breaks down food in your gut, like all bacteria do, this one has a toxic byproduct. And it can build up to levels which are problematic. So your body just starts to flush itself as you get diarrhea, and it's constant. If you have good healthcare professionals, they can actually tell the smell of C. diff excrement is different than normal excrement, and they will know it right away. It oftentimes has a greenish color too. If you do suffer from C. diff, this can be life-threatening because of the dehydration. So there's tools they have to address that particular illness, which I'm not going to talk about here, but when you have diarrhea, that can also contribute to dehydration. So when you have people suffering from that, you really, really, really have to monitor the intakes. It's critical. I don't know how else to put it. It's critical. Okay. I would also suggest that when you are dehydrated, there are drinks that provide specific electrolytes, sports drinks, things of that nature that will help replenish those electrolytes like sodium and potassium in particular. Bananas are very helpful. But to that extent, if you are on the dehydrated side, those things can be helpful in at least keeping an electrolyte balance, which is very important. Okay. What else can you do? So you have someone you love that you're visiting that's cognitively impaired. You don't know whether they're getting enough to drink. Staff aren't being helpful, which I've had happen multiple times. You ask the CNA when's the last time they drank, and they say 5 minutes ago, right? And you're sitting there thinking like, I don't think so. Okay, one thing you can do is called a skin pinch test. So there's parts of the body, but really the hand works just fine. You can take and make a gentle pinch on the skin and see how long the skin tense, they call it, right? It should snap right back to its normal position, but if it doesn't and takes a while, it could be a symptom of dehydration. Now, in the elderly, of course, their skin is thinner, so they may take a little bit longer to respond, but you would probably know fairly quickly. And this is a very common test for nurses and aides to do. So if you want a nurse to come in and do the skin pinch test, they will know this. They learn it in nursing school. This is like Florence Nightingale nursing. So at the end of the day, they'll know what it is and they can perform it, and they'll know whether or not it's a problem. And like I said, this is something you can do yourself. Additionally, you can look at urine color. Now, this one sounds crazy, but I have a case right now where I have a photo the family took of a catheter bag, and the urine is so dark it almost looks like wine. Okay, so the staff are completely asleep at the wheel. Now, urine color, right? If you can help your resident, if they're continent, go to the bathroom, just take a look at it before you flush the toilet. Usually, the volume is low, the color is dark, right? So if that is happening, then that is a direct indication of dehydration, right? Urine should be clear, hopefully, or maybe like yellow, but if it's dark yellow, that's a real problem. So to this extent, you can do this test. If your loved one isn't an adult, incontinence diaper, you can also look there too, right? You'll see it right away. They make the insides white for a reason. So you'll know right away whether or not this person is dehydrated. And of course, if they are catheterized, you can just look at the urine bag. It should be covered for dignity purposes. Just take a look. I will also tell you it's a great way to diagnose urinary tract infections too, which I've had countless cases where staff missed this one. But if the urine is cloudy in a in a catheter bag, that person has a urinary tract infection. Okay, and they need to get that addressed right away. When I discussed infections with dehydration, urinary tract infections is top of the list because you're not flushing out. If you do have bacteria in your urine, oftentimes the antibiotics can be difficult for the elderly's kidneys, or even liver. So usually, if they're prone to consistent urinary tract infections, or not consistent, but if they get them frequently, then oftentimes they'll increase what they're supposed to drink and give them cranberry juice, and the constant flushing of the urinary system will assist in preventing infections. Some of these others are also common sense, like just dry mouth. Now, like I said, if you have someone that's suffering from significant cognitive impairment, they're not generally going to tell you their mouth is dry. You'll just know it when you see it. Their breath is usually not very good, and you can tell that their mouth is dry. Sometimes you'll use a tool. It's like a little plastic stick with a sponge on the end to keep a mouth moist. A normal person does not need that kind of thing. So if you're seeing like the lips are sticking to the teeth or something along those lines, that's a major sign of dehydration. Okay. And of course, this sounds silly, but it is not always intuitive to people. If you have someone that is suffering from cognitive impairment that's telling you they're thirsty all the time, that's pretty significant. Like I said, oftentimes these folks don't necessarily know what is causing them the discomfort, although they're feeling it. And if a person is telling you that they're thirsty constantly, they are not getting enough fluids when you are not there, I can assure you, because they're telling staff and they're not doing anything about it. So there's an old adage that if you're thirsty, you're already dehydrated, right? So when you have someone with cognitive impairment that actually has the wherewithal to tell you they're thirsty, or they're pointing to their mouth or something along those lines, They are not getting enough fluid when you are not there. And that is something that if it was my loved one, I would want to address with the staff and nurses to be sure that they're taking care of this person when you're not there, which is what makes being in a nursing home both necessary and difficult for many families. Is obviously it's not the best solution for many folks, but that's the best one they can do. So we've covered dehydration, the potential dangers of it, what staff can do, and what you can do to help prevent and treat dehydration. Obviously, if you are concerned with a person who is suffering from it, they will be unresponsive. You know, their skin will not pass the pinch test. They need to get to the hospital right away. And the way the hospital is going to address this is not it will take care of this in a couple hours. Like they're going to run fluid IVs on a person right away to rehydrate them as quickly as possible. I had one case one time where the person did pass away from the dehydration. It was so severe. And I think that they took on 6 liters of water at the hospital. I was like, that is 3 Coke bottles of liter, or 3 Coke bottles of fluid that person required, and they still didn't make it. They still didn't make it. So, like I said, that I was shocked that you could have that little fluid in your body and still be alive. But that's what it translated over to. In fact, I had a visual for that particular case with literally Coke bottles, 3 of them. That's what they had to put into this fella at the hospital, and he did not make it, unfortunately. So those are the dangers of dehydration, what you can do, what you can look for, and what the staff should be doing. I hope it never comes up, but if it does, like I said, it's something you want to address as quickly as possible. So thanks again for taking the time to listen to me, and I hope you have a lovely day.